I grew up in the state of Maine in the northeast part of the United States, went to college there as well, and then I spent a year in Boston before going back to graduate school in urban planning and design. And then I lived and worked in Miami for about 3 years for a consulting firm before starting my own company, Street Plans, in 2009. And then I moved to New York City, which is where I've been based for the past 5 years. Street Plans is a consulting firm, but also what we call a research advocacy firm. We do a lot of active transportation planning, public space design projects throughout the United States and abroad. But we also, like I said, we do a lot of research and advocacy around these issues at a national level as well, trying to push the conversation and create resources and tools for communities to advance active transport and healthy living in their communities. Some of the best benefits of walking and active transport, in my opinion, are just being out with your community. Being able to see other people, have random interactions, social interactions in a way that's not possible in a car. Of course, there's physical health benefits that come with walking for transportation or even for recreation. We know that, but that's not necessarily exactly why people walk. Ultimately, we want people walking for convenience. It's just the easiest thing to do when they leave the front door, and it happens to be the healthiest way to get around as well. There's a variety of methods to engage people to be more active through walking. Some of them have to be long-term in their scope, and that's talking about land use and policy and developing towns and cities so they're more compact and have the walking infrastructure that's there. However, that takes a long time to develop in a lot of places or to redevelop in existing cities. So there's a lot of short-term things through encouragement, events, short-term projects that create places and destinations for people to walk and gather in. And those are some of the projects that we get excited about because they bring the benefits of walking to communities faster than waiting for the long-term changes to be put into place. Well, I think through the programs and education efforts of Vic Health, you've been able to reach a lot of people with this conversation, but also tying it together to a little bit more of a comprehensive view of health. So health isn't just walking, it's not just what you eat, it's not just smoking or not smoking, right? There's all these things that Vic Health supports and around the education initiatives and projects and policies that help, I think, Victorians be more healthy. Melbourne's one of the great cities in the world in terms of mobility and having options for active transportation. As you get further away from the core of the city, more and more challenges exist for active transport, walking, biking, taking public transit, etc. So there's probably a lot of things that even the region in Victoria could learn from Melbourne, no matter if it's a big city or small, on how to improve the livability and walkability of neighborhoods and then by extension their cities.
Authorised by Vic Health, 15 to 31 Pelham Street, Carlton, Victoria.